Hi to everyone. I am Dr. Saloni Chopra, consultant gynecologist who has done an MBBS from Bombay and post graduation from Pondicherry. Following that, I have worked in a government setup for 3 years and private setup for few years, and I have done my ultrasound laparoscopy as well as infertility courses, and I am working in my own private setup nowadays. And today we are going to talk about the very highlighted topic of the society, that is infertility. Infertility is generally seen in every third couple which enters into our OPD. And the reason for infertility being very high among is because of the late marriages of the couples, because of all the stress, and they are giving more importance to their career as compared to their family life. So, infertility is a condition which is seen in a reproductive age group of women, and it is when we call a couple as an infertile is when they are not able to conceive after 1 year of unprotected sexual intercourse. That means they were trying for 1 year without using any protection and they are not able to conceive. Then we call them as an infertile couple. But if the woman age is more than 35 years, then we call them as an infertile even after 6 months of unprotected sexual intercourse and they are not able to conceive after that. The infertility can be of two types, primary or secondary infertility. Primary means when they are not able to have even one child after marriage, and secondary means that they had a previous child but following that, once they are trying for their second children, they are not able to conceive. So the most common cause of infertility are the female factor causes, the male factor causes, as well as a combined of both of them. The female factor accounts for almost 40 to 55% of the cases. The male factor accounts for 25 to 40% of the cases, and the rest of them are the combined factors. So the most common cause of the female infertility is the ovulation problem, that is menstrual irregularity, and the most common cause of this ovulation problem or the menstrual irregularities are the hormonal imbalances happening in their body. The second common cause is the uterine or the cervical factor. Uterine factor means that there is some fibroid, there is some swelling, there is polyp, something inside the uterus which is causing infertility, and cervical factors means there is a problem in the cervix, which is the mouth of the uterus, which is causing some abnormality. And the third is the tubes. The tubal factor is also very important because our pregnancy is formed inside the tubes and then it comes inside the uterus. So if the tubes are blocked, if the tubes are damaged because of any reason, then there will be difficulty in conceiving. The fourth can be there can be an unexplained infertility. We don't know what may be the cause of it, and sometimes there is pelvic adhesions, that there is some the uterus is adherent to the tubes and the ovaries. There can be endometriosis, and sometimes if the female is having any cancer, then the treatment of that can also cause infertility. The medical conditions like thyroid, hypertension, diabetes are also one of the factors which can cause infertility in the females. So if we talk about the males, the most commonest cause of male infertility is the abnormal semen analysis. Abnormal semen analysis can have abnormal semen count. Sperm count can be very low. The motility of the sperms can be very low. There can be abnormal morphological forms in the semen, or there can be pus cells, infection in the semen analysis. All these factors can cause male infertility. Along with that, there are some environmental factors, like if some medications they are taking, drugs they are taking, smoking, alcohol, they are in a very heated environment. All these also can have abnormality in their semen analysis. And if they are also going for some cancer treatment, and cancer and its treatment can also give all these problems. And along with that, if they have a problem of premature or retrograde ejaculation, then also they can have male infertility. And there can be a combined factor, not only because once we are diagnosing the infertility, we have to check for both males and females. So sometimes there can be some male problem, there can be some female problem. So in that condition, we have to treat both of them. So what are basically the risk factors of infertility? The risk factors of infertility is the increasing age of the mother and the father, maternal and paternal ages, the smoking, tobacco chewing, alcohol, stress, and being overweight or underweight. All these things can take a toll on the infertility. And how do we diagnose infertility? So for that we have to diagnose male as well as female. So for male, we have to go for the husband semen analysis, which is the first and the foremost investigation to be done. If required, we can go for hormonal analysis, blood hormonal analysis, and if required, we can go for the ultrasound scrotum to see if there is any varicocele. In any of these factors, we can take the treatment with urologist to figure out what can be the treatment for any of the factors which has gone wrong out of all these three. And for the female infertility, the first and the foremost thing is we have to get a basic ultrasound, pelvis ultrasound, in which we see how is the uterus, how is the endometrial lining, how are the tubes and the ovaries, if there is any problem which we can see in the uterus, plus along with that, how are the follicles are forming in the ovaries, because this is these follicles which help in the formation of pregnancy as well as the menstrual problems. And second thing we have to go for is the blood hormonal levels to see the ovulation problem. If there is any hormone abnormalities, like there is a problem with the thyroid or there is problem with the LH and FSH levels, then that means they will be having their ovulatory dysfunction. So the second thing we have to go for is the blood test. And third thing is we have to look for the tubes. So the first test we have to go for the tubes are the HST tests, that is hysterosalpingography. If anything comes wrong in the hysterosalpingography, then the furthermore test which we can go is the laparoscopy as well as hysteroscopy, in which we see the whole uterus from the outside as well as from the inside, whether any of them is having any problem. And sometimes if required, we have to go for the genetic testing of the couple also, if they have any genetic abnormality which is causing problem for them to conceive. So how do we treat them? So the treatment part first includes counseling. Counseling is very important because the process of conceiving and getting treatment for infertility takes a toll on their physical as well as their mental health. So they should be very well prepared that what they are going to go through. And second of all, we have to counsel them regarding the frequency and the timing of the intercourse depending upon the female's menstrual cycle. And second thing is that we can start the patient on medications. Medications like we can, for the females, we can give drugs for ovulation induction, and we can see how their ovaries are reacting to it, how the eggs are forming. We can go for follicular monitoring along with that. And second thing is we can go for surgeries. Like if any of the investigations, if we find out if they have a fibroid or a blocked tube or polyp or endometriosis or any pelvic adhesions, we can go for the surgeries to remove that, so that the chances of them to conceive improves. And the third thing is that if the female is not able to conceive with this, then there are other modalities like intrauterine insemination is there, in vitro fertilization is there, that is test tube babies. There are surrogacies are there, adoptions are there. Then they can go for the donor. Sometimes if egg is having problem, they can go for donor egg. If the sperm is having problem, they can go for donor sperm, or they can go for the donor embryos also nowadays. And for the male also, we can give them medications to improve their fertility, and if required, we can go for the surgery for the varicocele. So that's it. I guess I have summed up everything about the infertility in a very short way and a very brief way. Though infertility can be talked upon for hours and hours and hours, but I hope this little briefing of infertility will help you. Thank you so much.